Hello everybody, today we are going over glucometer skills. We are doing a artificial simulation of checking a patient's glucose level. For reference, I'm using the National Registry skill sheet. So to properly demonstrate this skill, you're going to need a glucometer, a lancet of some kind, your test strips, an alcohol prep swab, a Band-Aid, or a 2x2 and tape, whichever your department prefers. It's also provider preference. So with this being a simulated lab, I'm not going to be able to get an actual reading from my patient, but I'm going to walk you through the steps necessary to actually obtain a reading in the field. So for starters, you're going to initialize your BSI, scene safe. My scene is safe. We are in the back of the truck. My patient is ready for transport while we are obtaining initial vitals, unless you did on scene. For my department, we usually don't get a blood glucose until we are in the back of the truck, unless it is a diabetic emergency call. So for this, it's going to be a routine check just to kind of rule out any diabetic issues going on with the patient. So you're going to swab the finger with your alcohol prep. Make sure that the affected area is clean. And while that is drying, you're going to take your test strip and you are going to insert it into your glucometer. And this one is not wanting to go in. Oh. All right, I'll try and edit that out. All right, so my glucometer is functioning. It is ready to take the sample. So now my area has effectively dried. We're going to take our lancet and inform the patient that it is, we're going to be obtaining a stick on them so that they're not surprised or anything like that. So normally it would go, I'm going to big stick, 1, 2, 3, click. Immediately dispose of your lancet into your sharps container. You're going to milk the finger where you are trying to obtain your sample until you get a good enough size drop of blood to obtain your sample. Once there's enough blood on your glucometer strip, it is going to beep, and then your reading will pop up in 3 to 5 seconds. After that, you're going to take some sort of bandage and clean the affected area, discard, and personally I like to put a Band-Aid on there just so that the patient doesn't have to hold on their own bandage. It kind of defeats the whole purpose of our care, making them kind of do our job for us. So it takes 3 to 5 seconds to put on a Band-Aid. I don't see why you wouldn't do that in the first place. And then your glucometer reading is going to come out at some form or fashion. You need to document that. So for me, I'm going to write it on my glove. That way I can inform the nurse whenever we get to the hospital during my report, and I can document it on my PCR correctly. And that is going to conclude the demonstration of this skill. Thank you guys for watching.